everyone, my name is Shannon Tippin. We are here today to discuss what is Brovana. So first, before we get into that, I'm going to tell you a little bit about myself. I've been a respiratory therapist now for 12 years. I have worked in all aspects of the hospital, from neonate to pediatric to adults to ER. I've been a part of several clinical trials, new medications, new protocols, new equipment, a lot of various things. And today we're going to discuss what is Brovana, how to discuss it with patients when it's being introduced, as well as what to say to physicians. So before we get started with that, we're going to introduce ourselves so that everyone knows who everyone is. Okay, sir, what is your name?
Caleb.
What's your pet's name?
Bergen.
And what's your favorite place to go on vacation?
The beach.
That's great. What is yours, ma'am?
Leah.
What's your pet's name?
Bella.
What's your favorite place to go on vacation?
Florida.
Mine too, Florida and beach, right there. And what's your name?
Samantha.
And what's your pet's name?
Shadow.
And what's your favorite place to go on vacation?
Jamaica.
Awesome, we all have the same theme here, beaches. So let's get started. So what kind of patients would benefit from Brovana? COPD patients are going to be our number one. Bronchitis, emphysema, any patients that have a clinical diagnosis of asthma will not benefit from this medication. There is also, it's considered a long-term maintenance medication that is given, it's going to be given on a daily basis. It's not going to be anything that's considered fast active. If you're in the middle of having an episode of not being able to breathe, this is not going to help you. What this is going to be is a long-term, twice daily administration for maintenance treatment of bronchoconstriction in patients. There is also some contraindications, which is a history of hypersensitivity to afromotorol, racemic, or anything else along those lines. So if you have any patients that have that charted in their history, or they've said anything to you, these are not the patients that will benefit from this medication. There's also side effects from this med that we need to make sure that it is explained to both physicians as well as patients whenever it's new. There is the most common or chest pains, back pain, diarrhea, sinus issues, leg cramps, and rashes. These should subside within 5 to 10 days. If not, then we need to discuss it with a physician in order to maybe discuss getting on a different kind of medication. So we're going to watch a quick video about a patient who is taking this medication now, and we're going to see what she says about it.
I grew up here in Indiana. I've lived here for a long time, and I've been happy here, and I've had a good life. I thought I was going to be healthy forever, but it came on gradually. And finally, I was diagnosed with COPD. I never thought I'd end up with COPD. I was busy and doing a lot of things, and I always worked. And I just thought it was just something that older people got. I got up in the morning sometimes, and it was very hard to breathe, and I was slowing down, and I thought, well, I need to go see the doctor and see if he's got anything that will help us get this sorted out and I feel better. When I started slowing down from not being able to breathe, it was very hard because I had been busy for so long every day. It's frustrating because you have to make a list every morning of what you're going to do that day. And some days you look down the list and you get ready to go to bed at night, and you haven't got but one or two things done, and then COPD slows you down again. I faced a lot of challenges living with COPD. When I get up in the morning, I would be freezing and hard to breathe, and I couldn't depend on not being coughing. I coughed a lot, and just slowed me down so much that I never knew where I would be able to finish the day without taking a nap or just sitting down and not doing anything because you couldn't breathe and no energy. My doctor and I were trying different treatments for the COPD, and we tried a couple of them. That's when my doctor told me about Brovana. My doctor said he thought it would help control my symptoms of time, there comes the news again, and I get that Bravana, and I track into my chair, and so I won't miss anything. Since I started Bravana, I feel like I can breathe better. For me, sitting around all the time, it's frustrating. Yeah, I feel like I can do a little more. I've noticed that I can get up in the morning, take my medicine, and go to my breakfast with my friends and enjoy it. I've been able to go places with my children and do things. This is just my experience. Everyone is different. To other people that have COPD, I would say go to your doctor, see what they recommend, and see if they can find a medicine that can help you as much as Provana helped me. I think it's very important for people that have COPD to try to live a normal life, because if you just sit down and don't do anything, first thing you know, that's all you're going to be doing. Try to make each day as important as you can, because you never know what you can accomplish.
Okay, so let's discuss two different patients and see if we can figure out how we would discuss this with the patient as well as how we're going to discuss this with the physician. So our first patient is a 45-year-old COPD female who was admitted to the hospital from the emergency room. She has complaints of shortness of breath and a productive cough. She has only been taken an inhaler at home, and the physician asked the respiratory therapist to evaluate this patient. So, ma'am, what do you think the first thing we should do would be?
Ask the patient more questions about herself.
Correct. I think that's a great idea. Since it just tells us that it's an inhaler, we really don't know what kind of medication she's been taking at home, as well as if this is something she takes all the time or just if she has issues. So the first thing would be exactly to go and talk to her. Let's figure out what she's been doing. Let's figure out how we can get her maintained better at home. So once we discuss with her, she only takes the medication as needed, but she's been hospitalized 3 to 4 times in the last year for respiratory illness. So do we think that Bravana would be something that could benefit her?
Yes.
Yes, most definitely. So let's discuss with her what Bravana is, the fact that it's something she'll be taking every day, and then let's go and discuss it with the physician as well. Explain to him that being on some kind of maintenance medication is what's going to help prevent further ER visits as well as hospitalizations for her. And remember, when we're discussing it with both the physician and the patient, we need to explain all side effects. So that way, if something happens, it can already be understood beforehand what's going on. So let's talk about one more patient. There's a 78-year-old COPD patient that has been inpatient now for 13 days for COPD exacerbation. She's getting ready to be discharged from the hospital and not taking any medications at home. The physician has now asked for the respiratory therapist to evaluate her before discharge. So we already know in this scenario that she doesn't take anything at home. So the next thing that we should do would be to go and discuss with the patient if there's some reasonings why, or anything that prohibits her from taking medications at home. Since she's been hospitalized, we know that this patient would be ideal for Bravana. 13 days in the hospital is an extended amount of stay for her. So we can discuss with the patient this and then go to the physician and explain to him the patient's no longer taking any medications at home, and what we can do to help prevent her from being reoccurring into the ER or into the hospital admissions. And make sure that we always talk about side effects with both physicians and the patient. So, does anyone have any questions? Yes, ma'am.
How do you take Bravana?
Okay, so Bravana is something we're going to take twice a day through our nebulizer treatments. It'll be the same as if you take any other medications from neb treatments. It's not something that's offered or provided in an inhaler based, only in a nebulizer.
Can it be taken with other medications?
It can be taken with Pulmicort, but that's about the only thing that it's recommended it to be taken with. Anything else, then I would make sure to talk to your physician first about.
And this is a maintenance
Maintenance only. If you're in the middle of having any kind of respiratory illness, any respiratory attack, if you're having issues on an onset of these issues, this will not help you get immediate relief from. This is only considered maintenance prevention to keep your lungs healthy.
So it's a preventative.
Preventative only, correct. I also have some paperwork by the door on your way out if you that just gives you a little bit more literature about it to be able to present to physicians that may or may not know what this new medication is. So is there any other questions? Is there anything I can help
How
you with?
long of a treatment is it?
For a home nebulizer machine, it probably lasts 10 to 15 minutes. In hospital, maybe 5 or 6 minutes. In the hospital, all treatments run off of oxygen or air, and it's compressed, versus the home machines run off of air that's circulated from the room in a machine and given out. So all home machines last quite a bit longer.
So is this a medication that needs to be taken in addition to other medications?
That depends. If you're currently having a respiratory illness, if you're having current onset of symptoms, I would take those fast-acting meds first, and then wait to take the Bravana until you're feeling better, and then switch from those fast-acting to the maintenance side of it. I wouldn't take all of the above at one time. Any other questions?
No.
Okay, thank you all for coming and listening to this. I hope it's something that you can use for our patient care as well as educating physicians about this medication.
Thank you.
Thank you.